Hello and welcome to Module 3, Chapter 1. This presentation provides an overview of Module 3. The chapter is split into 4 sections. First, we will provide an overview of the 8 chapters in this module. Then we will introduce you to your trainers, and after that we will guide you what to do next once you review the chapter, and finally we will advise you how you can get answers to your questions. So let us begin. Participatory Learning and Action Groups for Maternal and Newborn Health, PLA-MNH, is an effective, low-cost, sustainable and scalable approach for improving maternal and newborn health and reducing mortality. It works particularly well in rural areas where mortality rates are high and where access to services is low. The approach works by organising individuals concerned about maternal and newborn health to take collective action to address their concerns. The Participatory Learning and Action for Maternal and Newborn Health PLA-MNH course consists of 11 modules. We will be exploring Module 3. Module 3 explores the 4 key responsibilities of PLA-MNH group facilitators. 1. Facilitating the PLA-MNH group action cycle. 2. Reporting on PLA-MNH group progress. 3. Linking PLA-MNH groups. And 4. Building the capacity of PLA-MNH group committees. The module is built of 8 chapters. Chapter 1, the chapter that we are covering now, is an overview of Module 3. Chapter 2 provides an introduction to PLA-MNH groups and explores why PLA-MNH groups should be implemented. Chapter 3 explores the responsibilities of PLA-MNH group facilitators. Chapter 4 explores the knowledge and skills that PLA-MNH group facilitators need to facilitate the PLA-MNH group action cycle. Chapter 5 explores the PLA-MNH group reporting system. Chapter 6 explores how PLA-MNH groups can link with other individuals, groups, communities, and organizations to achieve their objectives. Chapter 7 explores what knowledge and skills PLA-MNH group facilitators need in order to build capacity of PLA-MNH group committees. And finally, Chapter 8 provides a summary of Module 3. Let's now introduce your trainers. Your trainers are from Women and Children First, also known as WCF. WCF is a UK-based NGO working internationally to ensure all women, children and adolescents can survive and thrive. WCF develops and tests low-cost community-based innovations to support women and children and adolescents to survive and thrive. This includes our flagship innovation, PLA-MNH, which is ready for scale, but also other early stage innovations which are being incubated, undergoing prototyping and testing. Women and Children First was established in 2001 by Professor Anthony Costello, former Director of Maternal and Child Health at the World Health Organization. Between 2000 and 2013, Women and Children First focused on designing and testing the PLA-MNH approach in collaboration with the UCL Institute for Global Health. This included working with partners to design and test PLA-MNH models through 7 randomized control trials in 4 countries, including Nepal, Bangladesh, India, and Malawi. Through these tests, Women and Children First helped to establish over 2,500 groups and test the impact of PLA-MNH in a population of over 7.25 million people. As evidence for the PLA-MNH approach started to build, Women and Children First also started to support training and scale-up of the approach. Between 2005 and 2019, Women and Children First trained partners and supported scale-up in 2 original countries, Malawi and Bangladesh, and with partners in 9 further countries, El Salvador, Guatemala, Honduras, Nicaragua, Sierra Leone, UK, Uganda, Ethiopia, and Myanmar. Through these activities, Women and Children First helped to establish over 2,500 more groups and reach a further population of 5 million people.
Now, let's put some faces to the Women and Children First voices you'll be hearing during this course. I am Mikey Rosato, a PLA Master Trainer and CEO at Women and Children First. I have a BA and MA in Anthropology from the University of Cambridge, an MA in Psychology from the University of London, and a PhD in Global Health from University College London. I am fortunate to have almost 20 years' experience in the design, implementation and evaluation of the PLA-MNH group approach in 13 countries. My PhD was also on the PLA-MNH group approach. It explored the mechanisms through which the groups work. And what have I learnt from my PLA and MNH group experiences? Well, I've been lucky enough to visit several hundred groups and observe over 1,000 meetings. And the truth is that I've learnt far more from these PLA-MNH groups than I've ever taught them. But what strikes me every time I meet a new group is how similar they are, even across countries, but also how distinctively different they can be even within the same district. Although every group is guided by the same approach and has the same drive to address maternal and newborn health issues, every group is made up of a unique set of individuals, bringing together a diverse set of ideas that enables them to solve problems in innovative ways. Every group goes on the same journey, but takes a different path. And ultimately, that is the power of the approach, unique local solutions to common global health problems. I hope this course inspires you to go on and support PLA-MNH groups in practice, and I look forward to learning more about the paths your groups take to improve maternal and newborn health and reduce mortality.
My name is Annemijn Sundal, and I'm a PLA Senior Trainer at Women and Children First. I have a bachelor's degree in Public Health at the VU University in the Netherlands, and a master's degree in Global Health and Development at University College London in the UK. I have focused my career in global health and development on maternal and newborn health and community mobilization. My master's dissertation explored the sustainability of the PLA group approach in Nepal, and I led on the publication of this study in a peer-reviewed journal. My experience as technical officer and now programs manager at Women and Children First includes design, training, implementation, monitoring and evaluation of the PLA group approach. I have extensive experience of delivering multiple trainings to various audiences, such as government and NGO staff, as well as local implementation teams, both in the UK and abroad. Why do I value community? I strongly believe that stronger communities make a real difference to the people who live in them. Community is by definition a noun. It describes a collective of people. But through my experience of working with the PLA group approach and wider community mobilization approaches, I have come to view it more as a verb. It is active, has motion, and impact. The PLA group approach enables a community to come together, work collaboratively towards a common goal, and realize impact as a result.
My name is Joanna Drazdewska, and I am a PLA Senior Trainer and Head of Programs at WCF. I have a bachelor's degree in International Relations and a master's degree in Development Studies from SOAS, University of London. I have been working in global public health since 2011 with experience of both health system strengthening and creating demand for sexual, reproductive, maternal and newborn health services in Africa and South Asia. My main focus now is community mobilization for better health by implementing, innovating, monitoring and evaluating and training in the PLA group approach. What PLA has taught me? What really convinces me about PLA groups, aside from the rigorous evidence behind them, is how they can make seemingly impossible goals possible. For example, when women from Malga, Ethiopia, tired of waiting for the government to build the promised maternity waiting home, took matters in their own hands. They made an action plan and presented it to the government, and together they cooperated to build the home. Or when teenagers in Oyam, Uganda, feeling empowered by their PLA group, spoke openly but respectfully to their parents that they don't feel supported by them and how their support really matters to their health and well-being. Individually, most would not feel brave enough to take these steps, which an active PLA group made possible.
Let us now take a look at what to do next. First, we recommend that you update the Module 3 Progress Tracker and then do exercise 1.1. If you do have any questions, please do not hesitate to email or call the team. One of us will be happy to help. Enjoy the course.